I would knock on the door and I would enter the patient's room and introduce myself. My name is Michaela Kicklider. I'm a student nurse at the USA College of Nursing, and I'm going to be inserting your indwelling catheter today. So I would check my patient's orders and see that I'm inserting and maintaining an indwelling urinary catheter and place on nurse-driven protocol to remove catheter when indications are no longer present. Some of these indications would be required immobilization for surgery, trauma, or other therapies. Strict urinary output monitoring as indicated by a plan of care. So hourly monitoring of urine output to guide volume resuscitation, hemodynamic instability requiring vasopressors, high dose diuretic therapy to assist in healing of open sacral and perineal wounds in incontinent patients, acute ventilator dependent respiratory failure, acute worsening of mental status, and palliative or end of life care. I would also check my hospital policies. I would perform hand hygiene and check my 2 patient identifiers. So I would see that this is Jaguar Jones. The medical record number is 417-6352, 417-6352. I would check for any allergies and see that he's allergic to penicillin, and that matches his chart, penicillin. So next, I would gather my equipment and don my goggles. I would position my trash can, and I would perform hand hygiene. I would position the bed, I would raise it to a comfortable working position, I would lower the side rails, and I would place my patient in dorsal recumbent position with his legs slightly bent. I would now don clean gloves and perform perineal care. So for a female, I would have a washcloth with soap and warm water. I would wash the far labia, the near labia, and then down the middle. In each section, I would wash with a different part of the washcloth. For a male, I would wash in a circular motion around the glans penis and wash down the shaft. And for both patients, I would clean the anal area front to back. Next, I would, washing the patient's perineal area before the procedure ensures that the area is not contaminated. Next, I would open my kit. And I would use my bag as a trash can. I would place it up next to my patient's hip. I would open the kit away from me, and then open the sides, and then open towards me. I would then come over here and don my sterile gloves. And I would place my sterile drape. And I would move this closer to the patient. I would prepare my cotton balls with betadine. I would place the lube, and I would connect the syringe to the balloon port of the catheter. I would then I would take off the plastic covering and place my catheter into the lube. For female patients, I would place 1 to 2 inches into the lube, and for male patients, I would place 5 to 7 inches into the lube. So now I would take my prepared cotton balls and I would clean the perineal area. So I would use my non-dominant hand to prepare the perineal area. I would wash the far labia, the near labia, and then I would wash down the middle. And I would next grab my catheter tubing. I would instruct my patient to take a deep breath and bear down upon insertion. So I would begin inserting the tubing. I would not touch the outer edge of the patient's perineal area. I would insert the tubing until urine output was received. And for females, I would insert it 1 to 2 inches further after getting urine output, and then for males, I would insert all the way to the bifurcation. So next, I would insert the balloon, applying constant pressure on the balloon until all of the saline is inserted into the balloon. Once the balloon was inserted, I would release the syringe, and now I would place the lure. The stat lock device. So the stat lock device is placed on the inside of the patient's thigh. It is on the inside of the patient's thigh to relieve any tugging on the urethral canal. You unclamp the stat lock and you place it around the catheter. You press down until it clicks, and then to place it on the inside of the patient's thigh, you just remove the coverings off of the sticky portion. So to remove the stat lock, you would use alcohol swabs to loosen the sticky off of the patient's thigh, and you would remove it, and also you would press down until it opens, and then you would just remove the catheter tubing. So next, you would place the collection bag on the side of the patient's bed. You would be sure not to place it to the side rail or any moving parts on the patient's bed. You would make sure you didn't have any kinks in your tubing, and you would make sure that the bag is kept below the patient's bladder. So after inserting the catheter, you want to collect a urine specimen. So you would take your tubing. So right after inserting, you would be able to remove the specimen from the patient's the collection bag. So you would remove the lid. You would have a graduated cylinder to catch any excess. You would remove this. You would unclamp it. You would be sure that you didn't touch the tubing into the specimen container. You would unclamp it, let the urine specimen fall, and then you would reclamp and reinsert. You would then recap, and you would prepare a patient label, placing the label onto the container and not onto the lid to avoid any mix-up with any other specimens. So if the catheter had been in for longer than 24 hours to collect the urine specimen, you would kink the tube and use the clamps. You would clamp the tube or use a rubber band to collect the tube, so you would have new urine collection in the tubing. You would wash the port with an alcohol swab, and you would grab a syringe while it is still clamped, and after it's been washed, you would insert the syringe and pull back to draw up your urine specimen. and you would remove the syringe. You would unclamp and make sure that there was no kinking in the tubing. You would remove the lid. And you would insert the urine specimen, being sure not to touch the syringe to the specimen container. You would then discard this and recap, and you would also place the patient label onto the container and not onto the lid to still avoid any kind of mix-up. So you would then clean up your area, bring all of your supplies away. And you would throw all your supplies away, and you would remove your gloves, glove to glove, skin to skin. You would reposition the patient in a comfortable position. You would lower the bed all the way into the lowest position, raise the side rail back up, make sure the call light and any personal items are in reach of the patient, and then you would perform hand hygiene, and you would document the catheter size, the amount, color, and consistency of the urine, the patient reaction to the procedure. You would document the specimen collection, and you would document daily catheter care. So plans to wash the catheter, the peritoneal area and the catheter site with soap and warm water, and also after incontinence of stool. And you would document your plans to remove the catheter as soon as possible. So next, I will demonstrate removing the catheter. So I would check the orders to make sure that I was supposed to remove the catheter. I would perform hand hygiene, put on my clean gloves, I would have my goggles on, I would be sure to empty the collection bag. I normally would not break my gloves. I would be sure to empty the catheter bag, the collection bag, into a graduated cylinder. I would measure the output, and I would then take a syringe. I would remove the stat lock and remove it from the patient's skin with an alcohol swab. I would draw back 0.5 cc's of air, and I would insert it into the balloon port, my syringe into the balloon port, and allow for gravity to remove the contents out of the balloon. I would then remove the catheter gently and steadily, and then I would discard of the catheter bag. I would then remove my gloves, glove to glove, skin to skin, and I would reposition the patient. I would assess for comfort, make sure that they're in a comfortable position, and then I would document the amount of urine, the color, and the consistency of the urine. If there was an odor present, I would document the intactness of the catheter tip. I would document how much water was removed from the balloon. I would document how the patient tolerated the procedure, and I would document patient teaching of the symptoms of the UTI, which it would be any back pain or discomfort, any constant urge to urinate, or any burning sensation. And I would come back and assess the patient 4 to 6 hours later, and I would make sure that they have voided urine, and I would palpate the bladder area and obtain a bladder scan if they have not voided.